Welcome to another episode of eHealth Matters. I'm Aisana. Today we'll be discussing a very important topic which I'm sure it has touched many of our lives, and that is anxiety. Today I'm joined by our lovely Rayco, who has traveled far to be here with us today, and he will be discussing and diving into the topic of mental health and anxiety. Rayco, would you like to introduce yourself?
Of course. My name is Rayco, and I'm a clinical pharmacist based in London, here in the UK. I've been a qualified pharmacist over 20 years, working across Spain and the UK. For the last 10 years, I've been working in the UK with a key focus on mental health. I started my journey in mental health auditing small private mental health hospitals all over London and the countryside for over 6 years. At the end, I was looking after 13 hospitals on a weekly basis. After that, I became the full-time clinical pharmacist of a very prestigious mental health hospital in central London. And by the end of 2024, I proudly joined a healthcare platform based here in the UK, while still doing medicine reconciliation for the hospital in central London.
Oh, I see. It sounds like you have been very busy, and you are definitely the expert to talk to us about this topic as well. So thank you for that. Talking about mental health, tell me, what does this word actually mean?
Mental health isn't just the absence of mental illness, so it refers to our emotional state, psychological and social well-being. It's dynamic, it fluctuates, and anxiety is one of the most common mental health experiences. It's actually a natural response to stress. It's part of our survival mechanism. However, it becomes a problem when symptoms are persistent, overwhelming, and impact your day-to-day life.
So if you're talking about anxiety in itself, is this an ongoing chronic condition, or can one, when we're referring to situational anxiety, can one only experience this when they are exposed to a trigger? Is that what performance or situational anxiety is referring to?
Performance anxiety, by definition, is related to a specific stressful events that trigger the anxiety response.
And what are the symptoms that one experiences?
The physical symptoms are part of the fight or flight response. That's part of the sympathetic nervous system, meaning racing heart, sweating, trembling hands, trembling voice, the sense of butterflies in the stomach.
So basically you're describing a lot of symptoms I experienced before I came into the podcast. Yeah, okay. And when do you distinguish between the normal anxiety that one experiences? Obviously, nowadays, everyone has a very stressful life, and anxiety, we refer to the word anxiety quite often within our conversations, day-to-day conversations. How does one distinguish between what is normal anxiety and what is the situational anxiety?
Normal nervousness, it's typically manageable.
I see, okay.
You might feel some jitters, but it doesn't impair your capacity of functioning.
Okay, so what about more of a chronic anxiety? So we talked about normal anxiety, something that doesn't necessarily present many symptoms. You can manage it and it doesn't affect your performance. We discussed situational anxiety, which actually does impact your performance. What about more of chronic types of anxiety? Can you tell me more about that, please?
We should mention generalized anxiety disorder, aka GAD.
Okay.
That's a long-term chronic condition characterized by excessive worry about a wide range of everyday things rather than just a specific event.
I see.
The worry is also disproportionate to the actual risk or threat. And the central feature is that it's persistent, diffuse, and difficult to control worry about multiple life circumstances, such as finances, health, family, or even being late. This worry presents most days for at least a period of time of 6 months. It often occurs with mental health conditions like depression or other anxiety disorder or substance misuse.
I see. Okay. So with general anxiety disorder, or as you said, GAD, it's a chronic condition which doesn't necessarily affect your physical symptoms like situational anxiety, but it also affects your mental health and how you perceive your surrounding, the state of your mind, basically. Is that right to say?
And that's correct. In contrast to performance anxiety, GAD is more generalized and ongoing.
Ongoing. Okay, that makes sense. And what are there specific treatments for GAD as well that you would want to tell us about?
Regarding medication, antidepressants are usually the first line of action. We usually start with an SSRI, which even when they are called antidepressant, what is important here is that they are thought to increase serotonin levels in the brain, and that affects mood, emotion, and sleep. When the SSRIs are not effective or not well tolerated, an SNRI might be more appropriate. If that doesn't suit the patient either, then the third line of approach would be pregabalin, which is an anticonvulsant, analgesic, and anxiolytic medication that is used to treat, for example, nerve pain, among other things.
Of course. Okay.
And we also use benzodiazepines for a short period of time, up to 4 weeks, to manage severe anxiety and crisis. We don't use it longer because of the high risk of dependence.
I suppose the message I take away from this is that there are many different types of treatment for it. So if one doesn't work for you, it's really important to go and see your GP or your mental health practitioner. So can you tell us more about different types of anxiety, if there are any actually?
We could mention a social anxiety disorder, also known as social phobia. It involves intense fear of social situations, social interactions, driven by a fear of being judged, scrutinized, or humiliated.
So is this similar to situational anxiety, but it's more of a chronic condition?
Yeah, so while performance anxiety overlap with social phobia, social anxiety is broader. It involves social interaction beyond just performance settings.
I see. Okay. And could you tell me more about how normal it is to feel this performance anxiety?
It's completely normal. Okay. Even some high achievers have experienced that. So just to give you some notable examples, Adele has publicly shared her struggles with stage fright. And other celebrities like Ariana Grande, Emma Stone, and Ryan Reynolds have also shared their experiences with performance anxiety.
Yeah, and it's great that such important figures share their experience, and I suppose it breaks that stigma that anyone can experience performance anxiety, no matter how experienced within your field you are, as if you're, for example, a musician. So let's discuss treatment option for situational anxiety. Can you tell me more about what would one person do who is experiencing symptoms of situational anxiety? What would be the kind of the first lines of treatment that they would be recommended?
For performance anxiety, the first line of approach would be non-pharmacological strategies. These are effective and empowering. So we should start with cognitive behavioral therapy, also known as CBT. It's highly recommended. It helps individuals to identify and challenge negative thought patterns, develop coping mechanisms, and gradually make them expose themselves to the fear situations. It's often accessible via the NHS services, which you can self-refer to. Then lifestyle changes like regular exercise, balanced diet, sufficient sleep. reducing caffeine and alcohol intake. They can all improve anxiety management. For performance related tasks, through preparation and rehearsal, we can build confidence and reduce anxiety. Some techniques like deep breathing techniques, muscle relaxation, and mindfulness, they can also be effective on reducing the physical symptoms of anxiety.
I see. Okay. With CBT, just going back to CBT, that's a very popular approach to a lot of mental health conditions. I believe there's also quite a lot of information through NHS websites. So other than the self-referral, that patients can actually go and practice this. Would you recommend for just for someone who doesn't have performance anxiety, who is just experiencing day-to-day anxiety of life as well, not necessarily with those intense physical symptoms?
Well, all psychological treatments are used for a very wide variety of mental health issues. Mm-hmm. So these are usually the first line of approach to any of the mental health problems. So, I mean, the psychologist will adapt the treatment according to your needs, patient's needs. So it will give the patient the tools to identify and challenge those negative thought patterns and to develop those coping mechanisms.
I see. Okay. Absolutely. But it is a form of therapy, right? Because there is obviously a stigma around therapy still to this day, unfortunately. There are a lot of people who, as soon as you mention, I recommend therapy for you, they're like, nope, that's not for me. So is this still a form of therapy then?
CBT is the most popular form of psychological therapy.
I see. Okay. So again, we need to break lots of stigmas then even around this. What about other more kind of pharmacological treatments as well? What if someone's tried everything that we just discussed, all the different approaches, and they still experiencing this intense physical symptoms? What do they do?
Okay, so the main pharmacological treatment for performance anxiety is propranolol. What propranolol does, I mean, well, let me give you some context. When we feel anxious, our body releases stress hormones like adrenaline and noradrenaline. Those hormones bind to the beta receptors. Beta receptors are, I mean, there are three subtypes of beta receptors found in different locations. And beta 1 receptors are mainly found in the heart. Right. And blocking those beta 1 receptors will decrease heart rate, will decrease the force of the heart contraction, and all these processes will reduce the heart workload and the blood pressure. Right. The beta 2 receptors are found in various tissues, including lungs, liver, and vessels. When we block beta 2 receptors, so it can lead to bronchoconstriction, vasoconstriction, and a reduced glucose release from the liver. And the beta 3 receptors are mainly found in adipose tissue and in the bladder. Its clinical relevance is not well understood. It hasn't been studied in the context of performance anxiety.
I see. Okay.
Beta and propranolol mainly blocks beta 1 and beta 2 receptors, and it has a much lower affinity for the beta 3 receptors.
Just so that I make sure that I'm following through, could you just say that in a simple term as well? So how propranolol reduces those physical symptoms?
In a nutshell, propranolol prevents adrenaline from having its full effect on the body. That means it reduces the physical symptoms of physical manifestations of anxiety, right, without affecting psychological thoughts and feeling of worry.
I see. Okay, that's something that I can definitely understand now. And is this an addictive medication? Is it one that we have to take long term, every day? How does it work?
It's not addictive. It's not habit forming. So and for performance anxiety, is usually it's often only taken before the stressful event. So I have to highlight that propranolol is a prescription-only medication here in the UK, and doses prescribed for performance anxiety are usually quite low, 10, 20 or 40 milligrams, 30 minutes to an hour before the stressful event. Doses might escalate up to 40 milligrams 3 times a day, but the exact dose and timing will be determined by the prescriber according to the individual needs and response.
Right, okay. So it's a medication that we can't just take after we start experiencing these physical symptoms. You really need to know your triggers. Right. You need to be familiar with what brings on those physical symptoms and to kind of plan ahead and be prepared. And I suppose that's halfway to try and managing any kind of anxiety, having that mental preparation and also knowing your environment and understanding your triggers as well. So I think that's quite important to say.
Yes, you should be fully aware of what situation trigger your anxiety so you can plan ahead.
Okay. And what about side effects? Can you tell me more about, obviously, any medication has side effects, a box of paracetamol has side effects. What should one expect in terms of common side effects of propranolol?
Most people tolerate propranolol pretty well. Some might feel some side effects, such as being tired or cold hands or cold feet, nausea. People might also experience racing thoughts, and difficulty concentrating.
I see, okay.
Propranolol is not suitable for patients who have a certain condition, especially asthma and severe COPD, because it might worsen breathing difficulties. Right. It's also not suitable for patients having certain heart conditions, like some types of heart block or uncontrolled heart failure, very low blood pressure or very low heart rate. Right. That's why thorough medical history and assessment by a qualified prescriber are essential before starting with propranolol.
Absolutely. I like to emphasize that it's so important that before you basically take this medication, you have to go and see your GP. You need to see a qualified professional. Unfortunately, there are a lot of misinformation out there. There's a lot of family and friends I've personally have seen it within my family where they're like, don't worry, just take some propranolol. And I'm just like, no, you need to go and see your GP or appropriate practitioner. So it's really, really important to make sure that the medication you're taking, first of all, is addressing the symptoms and also it is safe to take as well. One of the biggest barriers we have, unfortunately, in this day and age, which we touched upon as well, is the stigma around speaking up to say that they're suffering with anxiety or any other kind of mental health disorder. Could you tell us more about what these stigmas are and how we can overcome them?
The mental health stigma refers to the different attitudes, beliefs, and stereotypes that lead to discrimination against individuals who have a mental health condition. It's often fueled by a lack of understanding, misinformation, or and historical biases.
Right.
When individuals with mental health condition internalize those negative societal attitudes, it leads to feeling of shame, embarrassment, and the belief that they are less worthy.
Right, okay. And how can we overcome these barriers? If you had to give one sentence to one of your patients or advising a friend on how to overcome this stigma and to seek help, what would you recommend?
What's important is talking about how you feel and not feeling ashamed. Just saying I'm anxious can open doors to support. It's important to remember that it's okay not to be okay, and seeking for help is a sign of strength, no weakness.
That's a very, very powerful sentence.
Thank you.
So I suppose it's important who you speak to as well. So someone who doesn't dismiss when you do speak up, because surely that's going to put you off for good. So speak to someone that you believe can help you and reassure that, as you said, it's okay not to be okay as well. Would you recommend anyone else that one can refer to?
You could start talking to someone you know, someone who you know is a good listener, that someone you trust. Pick up a moment where you both have time to talk without interruptions.
Yeah.
You don't have to have everything figured out before you talk. Just saying, I'm feeling anxious lately, it's a valid start. Sometimes writing down what you want to say beforehand might help to organize your thoughts.
Yeah.
If you're speaking to someone you know, it feels too much initially, there are fantastic confidential helplines and charities in the UK like Mind Samaritans or Shout Crisis Line. They offer not judgmental listening and support.
I see. Okay. So we'll make sure that we add those charities that you mentioned, and if there are any other ones within our description as well. So I know that they are very accessible. It's usually a free phone line as well, or a kind of a free text message that you can communicate with them as well. And they are fantastic listeners as well. They might not give you any advice, but sometimes when you are in the situation, you just want to talk to someone, right? You just want to get it off your chest, and then you immediately feel better. Before we finish, do you have any other advice or word of wisdom you want to share with our listeners about anxiety or general mental health?
Don't hide themselves. They have to face their issues and talk openly, and openly talk to someone. We only have one life, so you have to live it.
That's really, really important. Thank you so much for your insight into that and for all your expertise that you've shared with us today. And to our listeners, if you're experiencing any symptoms of anxiety, any low mood, anything that you feel like is not like yourself, your friends or the family might notice that you're not your usual self, please do reach out to your GP and also to the helplines that Rayco mentioned earlier on today as well. Thank you so much for joining us for another episode of eHealth Matters. We'll see you next time.